My name is Amanda Harrison, and today we will be discussing dental hygiene in Russia.
Здравствуйте, меня зовут Noé Palm. I grew up in Russia for 11 years, and from interacting with the people there, I was able to see their access to care as well as their oral hygiene knowledge, which led most of the general population toothless by the age of 40. Affordable health care is a huge need in the area, but in the past few years, this need has been more willingly met.
The title of dental hygienist, or
Hygienist,
has only been accepted for about 10 years in this area of the world. In the Russian mindset for a long time, white teeth were healthy teeth, and restorations were only available for the rich. This is more of a British or French concept. In recent years, that idea has kind of phased out, and the mindset that preventative dentistry needs to be provided for all people has become more widely accepted. This is more of an Americanized or Westernized version of dentistry. Along with this, the population that is going to school for dental hygiene has also increased. There are about 24 institutions in the area that are accredited and are graduating future dental hygienists. So this profession is rapidly flourishing, and it is female-dominated, with about 4,000 female dental hygienists and 19 male dental hygienists. Individuals must complete a 2-year program in preventative dentistry with qualifications in dental hygiene, then pass Ministry of Education and Science Board in order to practice. While work visas are accepted for this profession, they are strongly emphasized that the individual must speak Russian fluently in order to be able to practice in this area. Under indirect supervision, hygienists are able to provide oral health education, pre-diagnosis of oral diseases, preventative and maintenance care of the mouth, care of orthodontic appliances. They often also assist with surgical procedures as well as extractions and orthodontic procedures, and also prosthetic procedures such as placing dental implants or bridges. The development of dental hygiene programs and treatment plans is also a big part of their job, where they work alongside the patient, dentist, or other oral health professionals. The primary governing body is the Ministry of Health, which provides legislation as well as creating the licensing board needed to practice dental hygiene in Russia. The Ministry of Health also expands into the medical field in all areas. 90% of dental hygienists practice in the private setting in Russia, with only 10% practicing in the public health setting. This is a more recent statistic as the access to care is broadening. I was most intrigued that the title of dental hygiene has only been around for 10 years in Russia, while it has been around in America for over a century. So there's literally a century gap in between when dental hygiene began in about 1913 in the States versus in the 2000s in Russia. This perspective is huge in how their mindset is changing. So that's all we have to share. Thank you all for watching.
До свидания.